Okay, so my first question is, when you hear the word diabetes, what do you think of?
I have family members that are diabetic, so I kind of understand the disease. I also work in the healthcare division. I'm a family healthcare advisor, and so I have a lot of clients that are diabetic. So I work with nurses and doctors to help get medications, to help get the supplies that they need to deal with their diabetes.
And what is your job?
I'm called a family healthcare advisor, and I work for the University of Kentucky, and we are an agency that helps people to get through the medical, the big words. As I tell people, you know, you go to the doctor and they throw all this big language at you and they hand you a handful of prescriptions, and a lot of people come home and they don't know what's going on with them. They know they need prescriptions, they don't know what medicines are, what they do, what's their side effects. We kind of go through that and we bring it down to the down-home level. You know,
That's so important.
It is, because Dr. Maddox told me, he said it doesn't do me any good to give someone a prescription if they can't get it filled, and if they do get it filled, they take it one day and then they'll go a week and don't take it the next week. You know, so we kind of help bridge that gap that's there to help understanding.
And you say you have some diabetes in your own family?
Yes.
Tell me a little bit about what that is.
My family is from Wolfe County, and it's on my dad's side, and it's scattered all through the family. You know, several family members have diabetes, some of them severely, some of them it's controlled and it's not so bad. And it's just, a lot of people that I find now, I have clients come in, they say, well, I just discovered that I'm a diabetic. They're 70 years old. Mm-hmm. You know, so they may have had diabetes for a long time and either didn't realize it, the doctor didn't catch it. You know, it's just mild. That could be borderline. Mm-hmm. You know, it's just one of those things that can kind of hide. Mm-hmm. if you're not really bad, if your levels aren't really high. Mm-hmm. You know, it can hide for mm-hmm. several years and you mm-hmm. don't even know. Mm-hmm. You can have, your eyes could be affected. You know, your internal organs can be infected and affected, and you didn't even realize that you had it. It's just kind of silent and deadly. Mm-hmm.
Do you worry about it for yourself?
I don't worry about it because I know that there's a possibility, because it's in my family before. You kind of know to watch that, you know, and my levels, my blood levels, even though I am overweight, you know, that you say, well, you're a prime candidate. So far, I haven't been. You know, my blood levels have been fine, my blood pressure's fine, but I know that it can happen at any time. So, you know, you just kind of have to watch, and, mm-hmm. and if in doubt, or if you think you might have diabetes, or you think you might have high blood pressure or something, go to the health department, go somewhere, you know, because it can really damage, it can do a lot of damage if you just let it go.
Absolutely.
And a lot of people do, because their health care, especially in economic times, you know, as rough as they are now, health care is not the top thing on their list. You know, they want to buy food, and a lot of times the food that you buy, the cheaper foods that people live on, they're not the best thing for you. You know, pasta's cheap, but it's pure starch, and if you're diabetic, that's an absolute no-no. Mm-hmm. You know, but that's just the way it is. They don't understand what to buy. The groceries, you pay your electric bill, you know, and other things, and they let their health care go. Mm-hmm.
Mm-hmm. What do you think causes diabetes, or what are some of the risk factors that are out there?
Now, what causes it, I'm not sure, and I'm not sure anyone actually knows, because it's different on a case-by-case basis. You have people that were born with diabetes, and they grow out of it. You know, you can have type 1 diabetes when you're a child, and in your teenage years it goes away. Why does it go away? I don't know if anyone knows. And then, like I said, you can be diagnosed in your 70s. I work with a lot of senior citizens. And, you know, this one guy that was working for the county, just a part-time worker, he discovered it. He's 76. Mm-hmm. Of course, he gets around better than I do, you know, mm-hmm. and he still works and is very active. He's not overweight. You know, he takes care of himself, but he has found out in 2 months. 2 months ago, he found out he's a diabetic. He had no clue, had no idea. So, you know, I don't know how you would say, or how would you explain how this happens. In my family, we think it's inherited, and I think that some of the doctors think it's inherited, but not always. Because you can have someone come up with diabetes, no one in their family has diabetes.
Yeah.
We're working on a study at UK, and that's what the study is, trying to, you know, why does this certain family have this? Is it connected to something else? You know, there's still a lot of questions that are unanswered about the disease.
Do you have any concern? There's an awful lot of children in rural communities that are overweight and obese even.
Yes, they are.
Do you see that here?
You do see that. You know, if you go to start in Head Start, you know, that little ones are overweight, and even up in grade school, and I don't know if it's the change in the activity. You know, when I was growing up, we were outside, hanging in the trees, playing in the barn, running in the woods, playing in the creek. We were continuously busy and doing something. But, you know, they don't do that now. You have, well, I lived out in the country, and a lot of people now live more in the town area, is what we'll call it here. You know, they live in town, and they don't have access to that. We have a couple of parks here now, and they stay busy. But you still, that's a few families that you see all the time, bringing their kids and coming to the park. But still, the kids are staying in the house, and they're little couch potatoes. They want to play their little Wii's and play their games, and they just don't get out and get the exercise.
Have any ideas about how to encourage families to get out and get more active with their kids? And
you have a lot of single parent families for one reason or the other, and you know, usually if that's mom or if that's dad, they're focused on making a living, you know, keeping food on the table, keeping the bills paid, and there's a lot of stress toward that, and then, you know, like Saturday or Sunday, a lot of people only get about 1 day off, if they get a day off. You know, the yard has to be mowed. You know, there's always things that has to be done, and there's the emphasis on family time. It's not there like it used to be. You know, load up and go to Natural Bridge and spend the whole day. Now some families still do that. And that's wonderful. I'm glad they can, but there's still, you know, there's a lot of, just for instance, we have 4 housing projects right here. And there's a lot of kids, you know, they spend their entire day, all through the summer, they're stuck right there. You know, mom or dad's either at work, or they don't have the means to get out. And if you don't have a park or somewhere to go play, your space is indoors. You have that one little area. You know.
Is there any activity programs that you know about in these housing areas?
Not that I know of. You know, not that they have play areas.
But no organized?
Nothing organized that I know of. But now, like I said, we have the new park downtown, the new city park, and then we have one up at the we call it up on the hill at the community center. And you know, if you're in school, there's ball teams, and there's stuff going on then. But if you don't make the team, you know, like I never made the team, I was never coordinated. But if you don't make the team, you know, there's still kids that are left behind. There's still people that are left behind.
Any ideas about things to do to kind of get them more active, or?
That's always a challenge. There's ideas, but then where does the money come from? You know, it takes money to put in a park. It takes money to maintain the park. And just honestly, you have to have someone to oversee the park. Someone has to be there, because you've always got that certain section of people that'll tear up. I don't care if it is concreted in the ground. They'll do their best to dig it up. You know, that's just there's always downfalls to everything. You have to have people that want to make a change, and you have to have people that don't care to volunteer their time, and volunteer their services and their vehicles, and you just have to have people that are able to do that.
A lot of people seem to think in other communities where I've talked that the churches might be one way to get word out and get people more involved. Do you have any ideas or thoughts about that?
I know that our churches here are very active. We have a ministerial association here that they do a lot of different things, and they're always willing. Again, it's the people that are interested in making a change, having the time to step forward and take time to do education and to promote, to get people to come out. You can have and say, well, we're going to do a diabetic education here at the library. It's going to be free of charge, and we're going to have food and everything. But if you don't get the word out, if you don't face to face, you can run it on the radio and put it in the newspaper. If you don't face to face and say, you need to come out. This is really important, and this is worthwhile. You have to. I've learned you have to face with these people. They were doing cooking classes through the Extension Office and the Diabetic Coalition, and some of the diabetes people, the clients that I work with, as they came in the office when I found out they were doing that, I said, they're going up to Red River, in your area. You need to come down there. And a couple of them actually did go, and they said, well, we had a ball. It's getting people out, getting them involved, and then it's word of mouth. If one says, well, I went and I learned how to do this and I learned how to do that, and they're going to next month come back and do it again, you need to go with me. That works. That has worked for me here.
I think that sounds like a good plan. What kinds of things do you think the schools might do to promote health better than they?
Well, now I don't have any children, so I've not had access and been in the school system. But I know that they do. They offer healthy snacks. But give them fruit instead of a candy bar. Let's have orange juice instead of Mountain Dew. Let's do. They're trying to, and even your fast food places are offering that healthy. That here it is, and we're offering it to you. If we can get people to understand that that's really what they need to do, and small steps. You don't have to go all of a sudden go on this big diet and go walk or run 5 miles a day. It's the little things, the little changes. You make a little change, you get used to that. You make another little change, and you get used to that. The next thing you know, you've done a lot of healthy things for yourself. And just little things that if you get used to it, you don't even notice you're doing that anymore.
One of the things that often happens is the school does some things with the children, but then we can't always get the parents involved.
Exactly.
Do you have any ideas about better ways to include parents?
Again, you go back to it's the time. It's having enough time to go to school. Let's go to this after school program. Dad works till 6 o'clock. Mom might work the second shift, so she's not home till 9. Or there's always situations, but it is really good if you can get the parents involved. And if you carry over what you're doing at school, you carry that over to home. You offer the healthy alternative. It's small steps, small changes.
Do you belong to any other organizations or in the community? Or?
I do a lot of stuff.
Okay. All right. So when you're out and about outside of your job, all right, because I know your job is health related, but in the community, do you ever hear people talking about diabetes?
Well, actually, right now, like I said, I'm doing that diabetic study, and everyone knows, because I am out there and I am involved in so much stuff. Most of the senior citizens, they know what's going on with me all the time, because some of the ladies are in the Diabetic Coalition. Well, they know that I came and, well, PollyAnna's doing this study, and then I went over to the senior citizens, and we're talking to these two, I had to start with 13 people is what we started with this month. And it's pretty much just seeing what they know, asking them questions.
All right, so
what do you know about yourself?
Yeah, tell me a little bit about the study that you're actually doing.
Well, it's questions, and like I said, it's finding out what you know about yourself.
Mm-hmm.
What are you actually? Are you doing what the doctor said? You know, they told you to test your glucose levels every day. Are you doing that? No, they're not. And it's have you been educated? Or if you're on insulin, have you been educated and do you understand how to do your insulin on the sliding scale?
Mm-hmm.
The ones that are doing the insulin, they know, the ones I've gave the survey to so far, they're really diligent about that.
Mm-hmm.
This is what they told me, and if this is my reading, this is what I do. And I ask about, I said, well, do you control it by diet? And every one of them shook their head no. I said, you just come here to the center. I said, you probably got up this morning and had breakfast. Yeah. And, you know, and I said, was it something that was good for you? Probably not. Fried eggs, fried bacon. You know, when they get to thinking about it, when you make them admit what they've done, then they go to the senior center and they have whatever's on the menu. Mm-hmm. Whatever it is, and it's not diabetic friendly most of the time, and I'm not throwing off on the meals because, you know, it's usually pretty good, but there could be changes.
Mm-hmm.
You know,
Mm-hmm.
there could be.
What about the activity? Do you ask them about activity?
Now, actually, they're pretty active. They do the senior games, and I'm just talking about this one little group of people. They do the senior games, and
now,
they go do
the
senior. It's Senior Olympics.
Oh.
And they go, I believe it's in Hazard or maybe it's in Knott County, and they go and compete against surrounding counties. Mm-hmm. And they really get into that. Now they're an active crew. Mm-hmm. They had a wonderful director that just left her job, and I hate it because she really got a lot of them involved. They took trips. They were going. If it was just yard sailing, they were getting out and they were moving around, and they loved her, you know. So I really hated to see her go because she had that knack. She could, come on and go with us, you know. We'll have a big time, and they had really been active. That's exercise that normally they would have just been sitting there in their chair, wait for their dinner, then they eat, load up, and go home.
Yeah, yeah.
But
so what are the
competitions?
competitions? Do you know what those competitions are?
Well, the ones I talked to was the cheerleaders. They have, you know, they even have cheerleaders, pom poms and all. And they did. I think they did like relay races, and then they had the cornhole toss, and I'm not sure what all the activities was.
Do you know if they have a local competition?
I don't think that they do.
Just when they go away someplace else.
Yeah.
So that might be something to actually
It
come
might
out
be.
here.
It might be.
Just a local
And they have a
competition.
lot of fun with that, and was very proud of their little medals. They've got them hanging up on a big display over there in the senior center. Yeah, they were very proud of that.
Yeah, yeah.
The thing about the senior center, you've got 35, 40 people that come every day,
Yeah.
you know, or 3 days a week or however often. But there is hundreds out in the county that don't.
Yeah.
They don't take advantage of that.
So how do we reach those people?
I don't know. It's one of those things. Someone needs to say, "Hey, you need to come. You know, you need to come over. We have a good time. We do this. We're going here. We're going there." And you know, we need to get the word out. They need to take advantage of that. Is one thing we do have, and they need to take advantage of it.
Do you think people feel welcome
At the center? The times I've been there, yeah, everyone seems really.
Do newcomers?
They seem to be, because there's always a root game going. They rarely even stop to eat. There's always a root game going. There's a few of the ladies that work jigsaw puzzles. I mean, those tiny 1,000, 1,500 piece puzzles. They've always got puzzles going. I go over and do bingo with them every now and then. We do diabetic bingo, ask them a question, educate them on something, and throw bingo in there with it, you know. And if I'm working with diabetes, there was a quarter that I worked with heart patients. and it was just throwing out a little information, you know, and just a little education could save a life.
Yeah.
You know, they say, well, Polly said maybe I need to see the doctor about this.
Yeah. Yeah. You said you're kind of involved with lots of things in the community. Do you think that some of the groups would be interested in having someone come and talk more about diabetes risks and the problems and what you might do about it?
It's a possibility, you know, and maybe even start with your Head Start teachers. You know, start with our little ones, and if the little ones say, "Oh, Mommy, we did this. This is what we did today," and you know, put education in their hands. You know, that's the way to get to them. It's just educate, and you have to do it over and over. Just because you did it once, that doesn't get it. You have to do it again, and then do it again.
I think you're on something. Well, I think I've asked you all the questions that I had on my list. Is there anything else that you can think of that you think is important to tell others?
It's you got to get the word out. You know, like I said, if you think there's something wrong, and I'm not saying run to the doctor, you know, every day. You can go to the health department. You can get a test kit and a meter. A lot of these come see me. The drug companies, the drug rep sends me cases of the contour meter from the Bayer company. And there's 10 strips and lancets. You know, if you think there's something going on, check your sugar yourself. It's simple to learn how to use those things, very simple. Check your sugar every day, 30 minutes, 45 minutes after you eat, and see what your levels are for yourself. You know, it's not a hard thing to detect, but it can kill you if I mean, it can destroy, like I said, your eyes, your kidneys. It can really cause problems if you just let it go. And it's something that we can do something about. You know, it can be controlled. There's medications that work very well. Sometimes you have to look around to find, the doctor will have to switch you to find the one that works the best for you. But we have some really good doctors here. They're really good. They they refer people to my office all the time that, you know, that are new diabetics, that people just found out they have high blood pressure, or, you know, whatever their problem is.
So I think I hear you saying that if someone thinks they have a problem, they could actually contact you.
Sure. It's an easy thing to find out whether you have diabetes or not. I mean, a simple little stick your finger and check your glucose levels. And if you do it for 2 or 3 days in a row, you know, you're going to see yourself what your levels are. And I'm not teaching people to self-medicate.
Right.
But if you think there might be a problem with your sugar, we all call it sugar instead of diabetes. If you think there's a problem, it's easy to check for. And then follow up with it. See your doctor. Go to your health department. You know, talk to your doctor.
Okay.